Hi, ladies and gents. It's AllieTalkz. But what I want to talk about real quickly, ladies and gents, or with my parents with Down syndrome, is the importance of early dental care. Sometimes, even when we do all the right things, it still doesn't mean that problems can't arise. Excuse me. That's what happened to me. I literally took my son uh, to the dentist starting at 6 months. They saw him at 6 months. They saw him at a year. And then, of course, the regular dental appointments that come afterwards up until now, which he's 3. And unfortunately, about 4 or 5 weeks ago, we learned that he started having issues with his teeth. And so, unfortunately, even though I have been brushing my son's teeth, he still is having problems with his teeth, and it looks like he is going to have oral surgery on his mouth. He's going to have a full restorative procedure done on his mouth in order to save his teeth and then to use it as preventative care. Now, I have switched to fluoride. I do, when it's possible, do floss his teeth. For my son, because it's so hard for me to brush his teeth, if I can't brush them the way I want, and I didn't bring the packet with me, dang it. I actually, off of Amazon.com, I actually bought some, it's like a little packet of actually mouth cleaner that you can get for babies, babies and toddlers, so to wipe their mouths out with. And so usually if I don't brush his teeth like I want to, now I use that as a backup to get what I missed. And so I would definitely say, from probably from when they're small little babies, I don't know small babies, but when they start getting teeth, and especially in the toddler stage, in order to get what you miss with tooth cleaning, or if you're not able to floss your children's mouth, I would say use that as a backup. Anything helps. But ladies and gents, I just want to stress the importance of early dental care, early dental hygiene, taking our children to the dentist, because even when we're doing all the right things, problems can still arise because of, their diagnosis. Their teeth still are weaker than the average child's, teeth. And ladies and gents, you have to think about the procedures that our children will have to go through. When you take little children anyway to the dentist, usually they don't like sitting in that chair. They don't like anyone picking and prodding in their mouth. Now, when it gets that procedure, unfortunately, gets escalated to another level, unfortunately, it does become a little bit more invasive when the dentist has to look into your child's mouth. And so the goal is for us to make sure that we can try and give them the most pleasant experience, that they can have at the dentist. Not like, see, if you look at that picture, he was not happy. And that was after the dentist did what she did. The scary part is that he was already looking a little bit apprehensive, because unfortunately we've been to the dentist more than usually, children and parents should be, a little bit more. So he's learned to recognize the environment. And so he was already a little bit edgy. After that, the picking and the prodding in his mouth and looking at his teeth, and you know how they have to do the count, he was just absolutely done. And so the goal is for our children to look like this instead of like this. And so, ladies and gents, remember, early preventative care at home, at the dentist. Don't forget fluoride as soon as you can introduce it. That's where the open relationship between you and your dentist comes in. Asking questions, just think about it, and research. I call myself doing research. I thought I knew everything, and because, I have other children. Um, but even with all my knowledge, there was just certain things I still missed, and unfortunately, one was fluoride. Who knew? And not to mention, I did with my son what I did with my other children, and realistically, I still should have taken into account that his teeth at this state, excuse me, at this early point in his age, were weaker than my other two children's because they're typical versus one that has special needs. All right, ladies and gents, I'll see you on the next run. Again, questions, dialogue, comments, I take them. Parents with Down syndrome, where are you? We should be having this conversation. You should be giving me ideas. I should be giving you ideas. We should be talking. Where are you? Please come out. And even if you don't have a child with special needs or Down syndrome, hey, if you have any suggestions, please let's dialogue. All right, ladies and gents, this is AllieTalkz. I will see you later.